So it's calcium. Amlodipine is a calcium channel blocker, sir.
That's good. Yes.
Other drugs in the group are like nifedipine. Uh, how are they classified? Is DHP and non-DHP drugs.
Okay.
Dihydropyr.
Dihydro.
Yeah. Difference between nifedipine and amlodipine. Amlodipine is long-acting and nifedipine is short-acting, sir. Uh, when to use verapamil? It's used in atrial fibrillation, sir. Dose is 40 mg. IV we give, orally we give, sir. And diltiazem also given in atrial fibrillation, sir. Rhythm control. Contraindication. And for proteinuria also, sometimes we give diltiazem, sir. Uh, that's also.
Okay. Amlodipine is a calcium blockers. Calcium blockers are voltage-gated calcium channel blockers.
Okay, sir.
This drug is acting on different sites like myocardial cells, conduction system, vascular smooth muscles, depending upon which group of calcium blocker they are. For example, nifedipine does not have any action on the conduction system. Verapamil and diltiazem has got effect. Okay,
Okay,
they
sir.
decrease the entry of calcium to smooth muscles. So in the periphery vessels, it produces vasodilatation. Cardiac muscle it will have negative inotropic effect and decreases the force of contraction, negative inotropic effect, and slows the heart rate. But nifedipine it increases heart rate, does not have any effect on the conduction system. Amlodipine has no effect on the conduction system. So it depends upon which group of calcium channel blocker you belong to. In general, these drugs are used for angina and hypertension. This is a drug commonly given for people with supraventricular tachycardia. During an episode of supraventricular tachycardia, if the non-pharmacological treatment does not act and adenosine is not acting, you may give this drug slow IV 5 milligram. Just begin very slowly. It may produce a sinus arrest or hypotension. And this drug can also be given in Raynaud's phenomenon.
Okay, sir.
The side effects common to calcium blockers are edema, constipation, carpal tunnel syndrome, and gum hyperplasia. Although this looks very simple, they go to dental surgeon for gum hyperplasia and they clean and they give antibiotic and so on. The drug history may give clue to diagnosis. And this carpal tunnel syndrome is very common in the community. You have to take this history. Verapamil is given for SVT, IV with caution. And the caution is the patient is already on beta blocker. So already on beta blocker, it cannot be given. This combination calcium blocker with the beta blocker is dangerous. So if the patient already on beta blocker, IV calcium should not be given. Diltiazem is given for hypertension, angina, is very strong negative inotropic effect. Amlodipine will not produce tachycardia, will not produce conduction defects. It acts on vessels and it is very long acting. So that's a preferred drug. Nifedipine, on the other hand, has a similar action but produces reflex tachycardia. So amlodipine is commonly given for hypertension. Okay, diltiazem has to be carefully given in angina. Verapamil is given for. So these are the calcium blockers. Okay.
Yes.
How do you treat the overdose? What does it produce? What side effects? It produces hypotension, negative inotropic, no?
Yes, sir.
Produces bradycardia. Verapamil, diltiazem can produce bradycardia, complete heart block, asystole. General measures are common for all drugs. Shock way to treat. IV fluids have to be given. Being a calcium blocker, we have to give calcium gluconate.
Yes.
And specifically, you give IV glucagon as in beta blocker overdose. That's a drug of choice.
Okay.
Let's go to what is this film?
So CT brain showing midline shift, sir.
Very good, very good. Midline shift and the sulci are not very prominently seen.
Yes, sir.
So you can recognize the herniation now. When you see the herniation, this ventricle
Yeah.
has crossed the midline. Can you see that?
Yes, sir. Yes, sir.
So this has gone to this half and this is very much compressed. So something is happening here. What is happening there? Any idea?
Um, there is an infarction over there, sir.
Can you please concentrate somewhere here? Okay. Can you concentrate here?
Uh,
Concentrate here. There is something there. There is something there.
SDH, sir.
It,
Subdural hematoma, sir.
it may be. It may be. Okay. So
Yes.
we just want to know herniation. What is herniation?
Herniation is a protrusion of the brain matter through the foramina, sir. Foramina magna.
The contents of one compartment goes to another compartment called herniation.
Okay, sir.
Okay. For example, if you have got inguinal hernia, femoral hernia, so in brain, where are the sites of
Yeah.
herniation commonly?
Uh, so brainstem, sir. Medulla. Uh,
Yes.
Uncal herniation, sir.
Uncal herniation is very good. Yes.
Yes.
And below the fox cerebri, this type of herniation can take place. No. So tonsils can herniate. Fungus can
Okay,
herniate.